My name is Glenn Lockhart. I'm the originator of Bion, and I'm a biochemist, and this is my older brother.
No.
Not older?
No.
Oh, this is my younger brother, Larry. He's a pharmacist, and he purchased the company from me for millions and millions and millions of dollars, which I am supposed to get in my next year's my reward of my life, or something to that effect. What we're going to talk about, what we're going to talk about today is the biochemistry. I'll wait just a second until people get seated. What we're going to talk about today is the biochemistry and the pharmacy of acne. One of the things that I have to do, and I apologize for having to do it, and that is I need to go back and explain to you the various stages of the progression of biochemistry, so I make sure that you know some of the new chemicals, biochemicals, that we're looking at in the progression. Part of it you will already know, but parts of it will be new, and those are the parts that we're going to deal with the most. As we reach puberty, and we're going to talk about puberty in just a few minutes, and maybe I'll shed some new light on hormones and the foods that we eat that do promote hormones and the state of development in this country. But puberty begets hormones, and the one that's particularly important to us is testosterone. Testosterone targets the skin, and within the skin there's an enzyme called 5-alpha reductase. It's an enzyme that attaches to testosterone, and it converts it to dihydrotestosterone. Drug companies have been interested in 5-alpha reductase for a long period of time because if you could limit 5-alpha reductase via a pill, then you could resolve acne. The problem is that 5-alpha reductase is responsible for thousands and thousands of other chemical processes within the body that are very advantageous. So if you limited the action of 5-alpha reductase, you basically would shut the entire body down because it's one of those chemical elements. Sebaceous glands have receptors that accept dihydrotestosterone, and the function of dihydrotestosterone is to produce the production of sebum. So subsequently, lots of testosterone begets lots of dihydro, begets lots of sebum, and the more acne potential you have. In the skin are bacteria, and bacteria produces another enzyme called bacterial lipases. The bacterial lipases attach to the sebum and they convert to free fatty acids. Free fatty acids are a skin irritant, something that you don't want as a result of bacteria, which is always present. It causes hyperkeratinization of the skin, that is excess cells, et cetera, and that's what causes the blockage associated with black follicles. On the skin at all times is Propionibacterium acnes, which we'll call P. acnes the rest of the time. And P. acnes becomes blocked in the follicles, it grows, it incubates, and it creates the infection of acne. The skin responds then by producing hydrogen peroxide. And hydrogen peroxide is a singlet free radical. It kills bacteria, but it's also very inflaming. The skin also produces histamine, which produces the red puffiness that you associate with acne, or anything that you would take an antihistamine for. Puffiness of the nasal cavity, the histamine response. So it produces histamine, and histamine interacts with substance P, which is a nerve fiber. I know this seems technical, but we're going to come back later to substance P because it's a very important element. It's associated not only with acne, but it's also associated with rosacea and a number of other elements in their ways of downplaying histamine. Cytokines are then produced, and they're specifically called interleukin-6, interleukin-8, interferon alpha, and tumor necrosis factor alpha. And those are all the pro-inflammatory cytokines. They create irritation, they create inflammation, they propagate things, so they keep inflammation going. And that is, in general, the cycle of acne. So as we look at the various causes of acne, we could say that all bacteria and P. acnes could be eliminated from the skin temporarily, and that would reduce acne because we would have less free fatty acids. So that's one of the things that we can do. We could also say now, and we know that we can do this, reduce the amount of testosterone in the skin. You've been told before in school you can't do that. They were wrong. You can do that. It's a little tricky and it requires some cooperation, but you can do it. And finally, the inflammation, that is the cytokines, etc., we can reduce their impact upon acne so that we can take acne that's out of control and bring it fully into control. Within the group today, how many of you have read the China study? Oh, one person.
I have it, but I haven't read it.
Oh, who said that? Read it. Absolutely read it. It's a wonderful, wonderful book. And I want to spend just a few minutes talking about that particular book. And if you do have a chance, do read the book because it's more than worth it. It was written by a man named T. Colin Campbell. And this would be worth writing down. It's called The China Study, T. Colin Campbell. He was the director, the national director of the National Cancer Research Institute in the 1990s. And it was during a time their worldwide study was conducted on the health of the world and our eating habits. So within this group, and it was the entire world, the Chinese government for the first time decided to interact with the rest of the world. And they submitted millions of patients for this study. What was important about it was we got to study people who lived in rural China, that is, the people who had no contact with the West whatsoever, and people who were eating in a manner in which they had eaten hundreds and hundreds of years before. So their diet largely consisted of very, very little meat because meat was expensive. It consisted of no pre-processed foods whatsoever. It consisted largely of vegetables and fruits. Know it well. So they basically became the norm. That is to say, they were as we were 1,000 years ago, untouched. So we could compare their health with the health of the rest of the world and make generalizations about how does diet influence things. And what they found out is we take their diet as opposed to a diet from the U.S., which is copious amounts of meat, a lot of dairy, very little fruit, very little vegetables, and lots of processed food. In China, the impact of cancer was negligible. That is, there basically wasn't any cancer. Particularly, there wasn't any breast cancer. Thirdly, there wasn't any acne. I mean, acne was basically unheard of. And as they looked at New Zealand, rural area, same thing, no acne. As they looked at Africa, rural area, no acne. So obviously there was some overlay there. The other thing they found is there was no heart disease in Africa, or excuse me, in China, rural China, and there was no cancer to speak of in rural China. So they started making generalizations. One of the things that they looked at, and this goes back to Colin Campbell himself, who later reanalyzed everything and called the book The China Study. He determined that in China, a girl goes into menopause at ages 15, 16, and 17. Why? No, flip it the other way. The lack of influence of animal hormones. She did not eat meat, she did not eat dairy, she had nothing stimulating her hormonal system to move forward quickly. On the other side in the United States, at what age does a girl go through puberty, go into puberty? 11. Good answer. So we've got 5 years right there. In those 5 years, the female is subject to hormones. 5 years longer than the U.S. In rural China, they went into menopause at age 42, 43. What age do we go through menopause here?
50.
Okay. So let's just say, let's be generous and say there's only another 5 years. So we've got 10 years of hormonal influence. It's double prong though. And the double prong is for 10 more years than our American counterpart, the woman is creating hormones that are influencing her body. And for 10 more years, she's eating, the Chinese woman is eating almost no meat, almost no dairy, and the American woman is eating copious amounts of meat and dairy. Ergo, we could say breast cancer in America is more exaggerated than anywhere else in the world. In China, it's the least. It doesn't exist. Okay, that helps you understand. Excuse me. All is linked more or less to diet. Acne is directly linked not to specific foods. The science has said it's not related to foods, and it's not. It's reflected in a lifestyle of eating. And this is why we have acne, but going right along with acne is the propensity for cardiac issues, cancer issues, a whole variety. So when you treat an acne patient who's got, let's say, mild to moderate acne, you are working with a woman who is potentially going to have cancer. When you are working with a woman who has moderate acne to severe acne, you are working with a person who is on a dead-end course, potentially great potential of having cancer or having cardiac problems.
I'm going to talk about a little bit about some of the prescriptive items that many of your patients and your clients have probably tried, and I'll give you a little background. I'll try to take 30 years of pharmaceutical experience. The last section is director of pharmacy at a major university's health center. To give you some insights on where we've been, what the other prescriptive, they come in, your client has come in and said, well, I was on minocycline, Differin, and they tried to talk me into Accutane, and you've all heard that. I'm going to give you a brief background of what these are, when you've heard of them, so you're familiar with what they are and maybe what other people are using. We use the word dermatologist. Family physicians are using these same products because it's a competitive world out there. They're going to write for it. They're not as experienced with the drugs to use, to prescribe, so it may be a little different variation. But in the United States right now, your leading prescriptive items for treatment are probably going to be Differin gel, Benzaclin, and Duac. And the last two are basically the same. Differin gel is a class of retinoids, and those are vitamin A derivatives. Differin is a synthetic vitamin A that's applied topically. It's very drying. It works for mild to moderate acne. And I just want to leave things out on that one. It's very irritating, and it makes the skin sensitive to the sun, much like benzoyl peroxide and some of the others. Another one of the products you may hear is Tazorat. It's another synthetic retinoid, similar effects, similar products. The one that's been around the longest is Retin A. Now that's a retinoid that has some relations to vitamin A, but it's not a specific vitamin A. It's a tretinoid, and tretinoid is now a generic. With that medication, it's a natural, and it gradually unplugs the pores, gets some of the sebum out. These don't work as a topical antibiotic. They can remove some of the oils, so you'll get a lot of dryness. If somebody said, oh, I tried Differin or Retin A, and it dried my skin out too much, it's kind of like when you use a Retin A or a vitamin A product for anti-aging. Sometimes they need to try it every other day to ease that out. So that's used topically. Then they will also, the typical thing is to use an antibiotic. Way back in the 50s, when my first zit popped, they used tetracycline just starting, and the old thing called Clearasil, and that was resorcinol, and that's about the best thing they had. Tetracycline has been used for all of these many generations, not used very much anymore because there's been a lot of resistance to it. So it kills the bacteria working from the inside out, but after a period of time, a lot of the organisms are now resistant to it, so they moved to other derivatives of it. Minocycline is a very popular drug right now. Doxycycline is a form. Doxycycline is extremely difficult on the stomach, makes you very sensitive to the sun. They're both generic products, so the prescriptions are less expensive than some of the other antibiotics. They're also currently using amoxicillin, the pink bubble gum that you gave all of your kids. They're using that. They're using, even now, because of the resistance, they're going to have to use stronger, different antibiotics, but then resistance develops to some of those antibiotics too. So very logical, very productive for generally a short period of time for the treatment of acne. The idea is to start out with a higher strength, and as it improves, drop down. Generally, if it's not working, it has a limited success ratio. Sometimes we have to change to different antibiotics, so there may be several. So you probably want to get a little idea when you have your new client come in, have they been to a physician, what have they been in, so you get a little bit of feel on what they've used before and what their experience with other prescriptions, so you can explain, we're doing it a little differently now. We're not going to use the same medications, because when they're sitting in your treatment room, they failed other places. So we need to try a different track. The effectiveness, when they initially go on, you either have very good success or it just doesn't work and we start changing. The benzoyl peroxide, and I switched this because on Duac and Benzaclin are a combination of benzoyl peroxide, the same stuff that is in most every over-the-counter and a lot of prescriptive items. That is in a compound along with clindamycin. Now, clindamycin is a very effective antibiotic that works topically to kill the organisms on the skin. They add the benzoyl peroxide because it helps the clindamycin work a little better. And it's not necessarily the benzoyl peroxide is that effective, the clindamycin is effective, but it helps the production. These are extremely expensive. They generally work very well. Most of the time they have to be put in the refrigerator, so your client may have to use a cold preparation on their face. Those group will take most of the prescription type of medications that your clients have been on with it. And we'll get around to it. Benzoyl peroxide is going to pop up many, many times. Our products don't use it because we don't need it. We don't sell against it, but we try to inform you what the properties are, what the harmful effects, the FDA warnings, and those types of things. And the other trouble with benzoyl peroxide is it has no staying power. You put it on, it kills organisms. It's very effective with that. But it doesn't have any staying power. So an hour later, its effectiveness is no longer there. So you kill, regrows. You kill, regrows. They add the clindamycin because that has a longer staying power and works a little better with it. Accutane, I'm sure you've all heard of it. It's either the devil drug or the wonder drug. Extremely expensive. Accutane, the brand name, is deciding to get out of the market, but there are several generics out there. It's terribly teratogenic, which means severe birth defects. The patient, both male and female, to get a prescription must sign up with a federal program called iPledge. So females have to go on 2 forms of birth control, and one has to be either oral or vaginal, the Orthoever or the oral contraceptives, and they want them to use a backup. Males, of course, don't have to do that, but they still have to go through the program. Unless you go through the program to certify, insurance won't pay for it. And we're talking $400 a month. It's wonderfully effective on the right patients. Dermatologists are much better at determining that, and it should be just a dermatologist that's prescribed it. I don't believe family physicians would have the ability to prescribe. But like everything, I saw a guy today. He had cystic acne on the back of his neck. He's been Accutane twice. Well, there's other ways to treat it. So it's overused. Sometimes it's underused. I've seen people that had some back acne and they've used Accutane. It's out there. It's very expensive. Severe potential side effects. Bright red, swollen lips if they don't use a steroid on their lips. Dry skin, especially elbows, knees. So it'll also take a couple other prescription anti-inflammatory and steroid creams to help relieve some of the side effects. How long it's going to stay on the market depends a little bit on how many lawsuits there are. because we're always getting reports that some woman decided, I want to get Accutane, they got it from their friend, they weren't on birth control, and they got pregnant. And I mean, we're talking about a fetus with no arms. So it's terribly, it's terribly harmful. When the patient goes through other treatments, they may not be successful. Some people do very well, and you'll never see them. But a lot of times it goes through a cycle. They become discouraged, they become depressed, they go from one system to the next. They'll start with their physician when they're teenagers. They'll go to the dermatologist, they'll get them fixed up. Our typical patient isn't necessarily a teenager because their mom and dad's insurance, they're being taken to the physician. What we see are the 25 to 45-year-old, the milk drinkers, the hormonal, the adult onset. They may not want to go to the physician anymore, so now they've gone to the internet, they've gone to Proactive, they've gone to other types of forms of medications, and so they've been exposed again to the benzoyl peroxide combination drugs that may or may not be effective for a long period, short period, but if they're seeing you because it hasn't worked. Some of these products are the antibiotics, benzoyl peroxide, some of the other topicals may work on one area. They'll kill, the clindamycin will kill the organisms on the skin. They won't affect the inflammation, they won't affect the sebum production. The benzoyl peroxide, same type of thing. You get a lot of different products that they'll work on one item. So you're treating one area of the acne and not treating the cause. And the cause are three different areas. You want to treat the bacteria, deal with the sebum production, and the irritation and inflammation that the sebum then causes. If you don't treat all three, you're not going to get quality resolution to the acne. So our products, we work on all three areas, so it's not treat one and let the others go, or having two or three multiple products to treat one individual. All of our products work along the line, and they all work together to treat several different functions. With our, well, you're going to get a little commercial, and then we'll go back. We'll go back. So sorry,
I did it. I'm sorry. I'm sorry.
Yeah. Our products are very safe. We don't use the harmful products. We never have. We never will. We team with you. We work with dermatologists. There's a dermatologist employee in the room today. That's fine. We work with dermatologists. We work with aestheticians, and we work with a lot of plastic surgeons as a team. We don't sell to the public. We don't work with the individuals. So we work to give you the education, you the expertise. We're available to be the team member on this, so you become the acne expert in your community.
Okay, now you're stuck with me again. What I did was just give you a quick synopsis of an easy way to cure acne, and that is we can reduce dihydrotestosterone, which then does reduce the sebum production. And that's what Larry said is one way of treating it. We can reduce the free fatty acids, which removes the irritation, and that's another aspect of acne. And we can reduce P. acnes in the skin, and we'll talk about how to do all of those today. I developed the products, and in developing the products, I went back to where we started today. We have P. acnes, we have 5-alpha reductase, we have this, we have that going on. And I went to the internet and did research for a couple of months on what natural ingredients or minerals had an impact on these various biochemicals that are involved in acne, and came up with a list. What I did from there was take the things that most commonly would treat multiple aspects of it, and those became then our list of ingredients. So we take the things that will not only kill acne, but will also affect 5-alpha reductase, will also affect inflammation. Our key ingredient, one of the key ingredients, is called cinnamon bark extract. And it comes from pure cinnamon bark. It's not the kind that you find in the bottle at the grocery store, but it's a cousin to that. Cinnamon bark extract very effectively reduces the influence of 5-alpha reductase. So we're not going to affect the ability of that chemical, that biochemical throughout the body, but on the skin and within the follicles, we're going to make that chemical incapable of being the catalyst that it normally would be. And it just sits there in a more inactive phase. So normally when we would have more acne, we can add cinnamon bark extract to it, and all of a sudden we end up with less dihydrotestosterone. Less dihydrotestosterone means less sebum, and that means less acne. So from the very beginning, we have sort of slowed the progression and made sure that the sebum production doesn't happen. We put that ingredient into two products. One is antibacterial cleanser, and that's for normal to oily skin. It's a cleanser. And the other one is acne inhibiting gel, which is for people who have moderate to severe acne. About 1% of the population, however, cannot tolerate cinnamon bark. And those people would end up with red, irritated skin. So we had to offer an alternative to it, and we'll get to that in just a little while. So it has great potential, but it has limitation in 1% of the population. I think you're probably already familiar with cinnamon bark extract, and it's, now we'll go to the more generic areas. What are they using to treat diabetics that is not a drug, do you know?
Cinnamon.
Yep, cinnamon, that's it. Anybody know anything else they're using cinnamon for? Pardon?
Sunscreen, isn't it in sun?
It can be in sunscreen. It's a perfectly natural sunscreen. Could be there. Cinnamon is very much in research right now because they're finding out that it's very bioactive. It does a great deal in the body. It controls, in working for diabetes, it controls insulin production. Do you know that insulin is a hormone? Okay. So we're finding now that they're looking at it as a controller of hormones within the human body. So it's a good product, it's a good ingredient. People will recognize that this is a legitimate ingredient that has some significance to it. I'm sorry.
I was going to ask, would you recommend that as an internal for people to take as well as being on a treatment like
the trouble with internals, and you're going to find mixed reviews, the skin is sort of at the end of the train.
Okay.
Yeah, so things don't get there. We keep harping. In the case of, I will harp, pardon me, I'll harp, about eating antioxidants, but I only harp because if you put a load in, granted, parts of it will be stolen, but there still may be enough residual to get to the skin. With cinnamon, it just isn't going to get there.
Okay.
So it's a great thing to have your customers take, knowing that that's not going to be the solution, but it can be an augmentation to the solution. We looked at other things, though, that controlled 5-alpha reductase. Not surprising, green tea came to the top of the list. And I don't have to tell you all the other things that green tea is used for. It's a wonderfully bioactive ingredients. Turmeric. Turmeric is contained in seasonings like curry, and India has often been marveled as an area where cancer doesn't exist. And it's attributed to the curry that they eat. And actually we use turmeric and we use curcumin, which is a specific part of it. Zinc inhibits 5-alpha reductase. So these are 3 additional ingredients. We put these ingredients then into the other cleanser, so that you now have a cleanser that is cinnamon bark, and that's for oily to moderate acne, oily to moderately oily skin. And then we put it into bacteriostat, these ingredients into bacteriostat, because it's non-irritating, and this cleanser now is for dry skin or mature skin. And as Laurie mentioned, we're finding a lot more mature acne, and you're probably treating a lot more adult onset acne because they wonder what's going on with their skin. And that takes us back to eating, which we'll get to. We also put it in the follicle clearing lotion. We put it into the green tea clay poultice and a number of things. So we covered the base everywhere with it. One way or another, we're going to inhibit dihydrotestosterone from existing in in the skin or existing in any abundance in the skin. So our approach to acne then has been to block acne, not to treat bacteria, but to actually block acne. And it was as a result, with Vion products, you will be able to control 90% of acne patients who walk into your studio, your office, your clinic, or whatever. And that control will happen within approximately 3 to 4 weeks. Let's look at some other things too. As Larry said, that's a good word. Larry said that we have to have a multiple approach. And the second one is we wanted to find ingredients that killed P. acnes. And we didn't want to use benzoyl peroxide. That took us right back to cinnamon bark extract. Not only does it do all the other things, it kills P. acnes, wild oregano, an ingredient that you will hear more about in the future. Licorice, you already knew about. You knew that licorice kills P. acne and it kills a variety of other things. Salicylic acid does it, and salicylic acid has the additional benefit of clearing the follicles. So that was a good ingredient not only for P. acnes reduction, but for keeping follicles open. And triclosan, and we use triclosan 2 ways. We use it not only to kill P. acnes, but we also use it as a preservative within the product. We set it very, very, very low. It's less than 1/2%. So it's not the legally allowable solution here in the U.S., but it is legally allowable in Japan, in Europe, in Canada, and Australia, all of the countries that have really rigid requirements. And it's ample with the other ingredients to act as our preservative. Combinations of these ingredients are contained in all of the Vion products. So we'll cover that base. Sometimes you'll have multiples, 2 or 3 that kill P. acnes. Inflammation was a difficult one. And going back again, you're going to have the involvement of hydrogen peroxide, of histamines, the response of P. acnes, and the interleukins, interferons, all of those. We used, again, cinnamon bark extract as an anti-inflammatory, which it is. We use zinc again as an anti-inflammatory, and zinc we'll end with as one additional explanation as to the biofunction of zinc within our bodies. We used oregano, turmeric, neem, and green tea, all of them to reduce anti-inflammatories or inflammatory agents, and all of these are found in Vion products. Substance P is a very interesting material. It's not a chemical, it's nerve fiber. And substance P is throughout your body. Within the skin, substance P lies adjacent to the sebaceous glands. And when substance B is agitated, and one way to agitate it is stress, it produces an enzyme called endopeptidase. Endopeptidase targets sebaceous cells, and it causes them to grow in size and grow in numbers. So if sebaceous cells grow in size and numbers, what do you get? More sebum. Yeah. And that's why people say, when I'm stressed, my acne is really bad. Well, of course it's bad. And the more stress you have, the more the sebaceous glands multiply and grow and grow and grow. So we wanted something that worked with that. Excuse me. I'm trying to look at which slide I'm on. Oh, yeah, there we are. And I'll go one more. So we introduced, again, zinc as a controller of substance P, oregano, and one more time cinnamon bark. When I found cinnamon bark, it was just like the end of the world. It was like, this ingredient is so good because it does so many other things. So we introduced those then as controllers and regulators of substance P. Let's make an application of this. Let's say you have a person who walks into your salon and they have rosacea. Rosacea is a stimulator of histamine. That is, they'll not only have vasodilation, but they'll have histamine, the skin turns red. The histamine then affects the substance P. The substance P then produces endopeptidase. It affects the sebaceous glands, and all of a sudden you have a customer who has acne rosacea. So that's how rosacea then becomes a natural progression into acne rosacea. So to a certain extent, we've said in our materials, and we're not going to go into this today, you can treat acne rosacea with these products because acne rosacea is a stimulatory effect on substance P. Substance P, by the way, is downregulated by all of the inflammatories that we said earlier that we use. And I won't go back to those again whatsoever. Any questions about how we selected, why we selected? And you'll find they're all natural, they're all minerals or botanicals, they're all perfectly safe. Yes, back there?
Is the cinnamon bark stimulating to the skin? Does it feel tingly?
Yes.
Okay.
Yeah. And the more tingly, the greater the probability is that that could be somebody who's going to be reactive to it. So tell them to use it for 3 days if their skin is just fine. It can be a little warm and tingly, but it's fine, they're okay. But if they're going to react, they're going to react on day 2 or day 3. And all that you do is take them off of that cleanser and put them onto the bacteriostat cleanser, and you just march forward.
Would they get a rash then or something?
They get redness.
Okay.
Yeah, and once they have redness, you don't want them to go any farther. You just want to stop. And knowing that, and you should tell them that internally that cinnamon is not the best thing for them.
Okay.
And just stay away from it. And that would be unfortunate if they develop diabetes, because that might be a natural way of controlling it. Question back there.
Do you find that an ingredient's effectiveness is determined by if it's organic or non-organic? For instance, the cinnamon bark?
No, I find it more an area of refinement. There's a lot of bio-trash, and we've been very, very cautious about where we get our raw ingredients. We may pay a little bit more, but for example, we would never get a raw ingredient from a country that has a bad reputation, and there is a country out there that has a horrible reputation. It's a good place to get cheap ingredients, but not a good place to get effective ingredients. Other questions?
Another one. Just to go back with the rash, from a pharmacy standpoint, you'll get a mild redness. Removing the causative effect will almost always take care of it. If they develop pustules, that type of stuff, then that's probably they're really sensitive to it. Then it may be a time to say, you probably need to call your physician, because then that could lead into something else. Rarely happens. Err on the side of being overly cautious on it. You know, it's better to say, might be it's not your fault, because they didn't know you didn't know on it. So that's one thing you might want to just follow up with, is just qualify with it.
If I could say one more thing to Iogi, that if before they leave and you're going to be using that ingredient in their product, rub it onto their face and look for redness. If it's going to happen, it's going to happen there. So you could almost make the determination before you even send them out if you want to.
Yeah, and it's 1% of the population. It's really rare that we've had that on it. Real quick, Bion does what we've just been talking about. So this is just a little bit. I'm going to tell you what we have, and then we'll get back into some other things. Bion products, we reduce the dihydrotestosterone for less sebum. We're going to reduce follicular inflammation and the blockage, and we're going to kill the P acne. So we work on all 3 areas we talked about. Controlling acne with our products, about 90% or over. The other 10% we'll talk about sometimes can be a hormonal adjustment, so we can get close to that 100%. If you don't get a cure, well, I don't want to say cure, we guarantee this stuff 100% to you. We have products for facial, and we've come out with a new body wash for body acne. What we found out that a lot of people, they'll use their facial on their face, but they don't want to use it on their back, their chest, their butt, wherever they may have acne, so they just deal with it. You know, I've had that for years, and down the middle of the back is generally due to soap. Around the outside of the face, we can change soap. This we developed to use as a daily shower gel. Use it with a loofah. It has a wonderful fragrance. We hit a home run on the aroma. Use it as a daily. That antibacterial. It works for your, after tennis. It'll kill odor. And we did an accompanying moisturizer to go with it. The same fragrance. They both have 8 essential oils, so they moisturize. We have treatments for acne rosacea and regular rosacea. We have specific things, blackhead and milia. We have a blackhead whitehead controller used with one of the cleansers. We'll clean up blackhead, whitehead that people have never been able to do before. And one of our products works on folliculitis Barbie. You've got little cold sores that if they apply it first tingle 4 to 5 times a day, in about 2 days, that will be gone. So, post-waxing, after shaving, ingrown hairs, and that sort of stuff. So we've got the product, but it's a simple little system to go. 9 specific products for acne. We can treat from mild to severe. People say, well, what about the really severe? If you treat mild and it's the same ingredients for the really severe, we add a 4th ingredient to the really severe. So you use the same regimen of 3 items for your mild through moderate. For your really severe that needs that little extra kick, and you'll see a picture of a young lady that needed that extra kick. We have that one acne inhibiting gel to be used for that person that you're really fighting. And we have the selection to go either dry, oily, combination, and that type of. We offer information materials, and they're at our booth, but we will offer you. This is for acne, but we also have these for anti-aging. We have them for our skin damage, sun damage rejuvenation. We have them for anti-aging, several different light reducing. We provide these to you at no charge. Just ask for them. What they have in them are information, brief information on the condition, and then we put on for acne the regimens. So you just circle your acne, this is what you're going to need. It has exactly when they use it, how they use it. If it cakes, do this. So you hand them this, they take it home. On the back, you put your name, your address. 4 weeks, you come back and see me. We're going to do another extraction. We'll get you some more medication and that sort of stuff. So that's all on there. So we provide you that information. We also have extensive educational pieces, some things in written form that has some, in brief, this type of information that we can provide you. Our website is it's sanitized. You use it, full of information. Your clients can use it. We do not sell over the internet. We do not have a shopping cart. As I said, we sell to skincare professionals only. So you can go there. We've got all of our products, all of our ingredients, and an education side that goes through a myriad of every product we've got, the background on it, how it works, why it works, and all of that information. You can send your clients and customers there to take a look and read so they get the information. There's nothing there you wouldn't want them to see. So when you get home, ionresearch.com. It's very informative. Again, 3 cleansers, 2 gels, 1 leave-on, green tea clay poultice. It's a natural clay that has from a secret mine, and it actually pulls the infection out of the skin, and you leave it on through the day. So as opposed to some other treatments that work now and an hour later, they're not working. Our last 2 products, you leave on during the day, so you have 24-hour coverage. So you're fighting all of the symptoms, all 3 symptoms, 24/7 around the clock. That's what gives us the edge. It's not a 10-minute treatment twice a day. It's a 12-hour treatment twice a day. And even with the green tea, we've got lots of stories. I was getting on my desk, cut my head on the little tray for your keyboard. 6 stitches later, went to the emergency room. They said, well, put on Neosporin or something like that. I used green tea clay poultice. I went back to get my stitches out, and they said, what did you use? You aren't even going to have a scar on this. So now the emergency room doctor wants to use green tea clay poultice on everything. So that's okay. And as we said, 3 products twice a day. The regimen is fairly simple. And severe acne, I mentioned you use that fourth product, the acne inhibiting gel. That helps rebalance some of the skin chemistry. It's that little difference that makes that one kicker that makes all this work better with rebalancing. Really reduces the inflammation because these are probably going to be the cystic acne, they're really severe, and it also treats other products or other conditions.
Me again.
Quick question.
Yes, Larry, I have a question.
Oh, yes, ma'am.
You said use the acne inhibiting gel for 4 to 8 weeks?
You can. That's generally what we see. Usually after about a 4-week treatment, it's should be under control enough that you can decrease or de-see it. If they need to continue with it, you're the skin professional. That's why you want them to come back. We're not just here it is, sell it to them, send them home, see you next time you buy it. You want to come back because you still want to monitor, control. If they come back, they're still seeing significant inflammation, continue with it. So it may be 4 to 8 weeks. Some people may take longer, but it's designed to be more of a short-term course than a lifelong course. Yes?
And I overlap the blackheads and whiteheads controller with acne inhibiting gel.
You want to.
Can I do like blackheads and whiteheads?
Yes.
Yes. You'll want to use the cleanser either one of the cleansers, either the cleanser for oily or cleanser for dry. Apply the blackhead, whitehead next, and then your other treatment, whether it's the follicle clearing or the salicylic glycolic on top of that. But yes, you can combine that. Or you can just use the cleanser with the blackhead if they only have the milia or the blackhead, whitehead, and they don't have the acne.
In fact, within the booklet, within the little pamphlet that he shows, there's a section that says blackheads and whiteheads with acne, and that outlines exactly what he just said. So you don't have to try to remember this. It's in the material there. Any more questions? Okay. We find that there are certain patterns of response, and they're real easy to predict. This is where we're going to make you a real expert. 65 to 75% of the patients are going to just have a very nice progression. And the progression is going to last for about 3 to 4 weeks. When they come back in at 4 weeks, they will say, my acne is under control. It's done. So that's about 2/3 of the people who are using it. And let me give you some examples of this. This was, I wish this was a little brighter, but I think you can see it. This was moderate acne as she started on the program. And this is the same woman 4 weeks later. So she knows that she's totally under control. All that she has to do is keep using it, letting her face heal in the natural progression. Next group, young male, came in, and you'll see that what we've suggested that estheticians do is when they come in, photograph them. Because you need files and you need selling material. So he's already in.
So do we.
All of the people.
You get good pictures, send it us, I'll give you free product for a while.
So there he is ready for his first facial. You can see he's got moderate acne, and he's got, notice the erythema even into the nose. That tells us something about him, and he was kind of a special case. There he is 4 weeks later. He's progressing very, very, very nicely. This was an interesting case. She was more in the severe range. And this was more in progression. At this point, the histamine within her face is so much that you can't even see the scars in her face. So she didn't know how scarred she had already become. And this is about, I think, at 5 weeks. And now you see the scars? They're all over her face. And later I'm going to tell you why she's scarred and what we can do to prevent that from happening. Even if it has occurred, we have a window of opportunity for several months to reverse those scars. Here she is then at full 9 months, and we had to go that long with her. Not that we didn't have the acne under control, because as you can see, at 5 weeks we really basically had it under control. But we had pigment issues, we had scarring issues, a very, very bright young lady who's in college with a good career ahead of her, so we wanted to do as much as we possibly could to reverse the skin damage. And that's her at the end. There's another group, though. This group makes up about 20 to 25% of the people that you'll be working with. And they are the group that we call the flare-up response. So you put them on the product, in about 3 weeks, their immune system finally kicks in, and the product is working nicely. All of a sudden, all of the pre-infection development that they have in their skin is going to come to a head. It's all going to raise all at one time, and they will call you and scream and say, this is not going well, it's making everything worse. So we find it's really better to say, you may experience this at 3 weeks. And if you do, just keep going right ahead, because your results are going to be the best. And that is, after this flare is cleared, you're done. It's gone. So it's a very, very nice resolution to it. That takes us up to 90%. So at that point, we need to talk about the other percent, 10%. And it's a group we already talked about before. They have been everywhere else before. Nothing has worked. And the problem isn't the product. In fact, the product might have even acted for a while like it was going to work. And then it didn't. But this 10% has dietary issues and dietary problems. And it becomes essential for you if you want to get 100%, and I'm sure you do, this is where you need to make some determinations. So I'll tell you the 3 things that we look at in the order of the easiest to diagnose. And then you can do exactly the same thing. Hormonal, it's the predominant one. How do you recognize it? It is usually females, but not always. It could be a guy who eats butter and cheese like it's going out of style, and that causes his hormones to flare. But it's usually female, and the pattern is right across here. It's the jaw, chin line area. It normally flares with their monthly cycle, and then it goes back into a calmer position, and then it comes back again the next month, and then goes away a little bit. So this is pretty easy. You can ask them, and you can spot the pattern here. They may have some other hormonal issues. They may have facial hair. They may have loss of hair on the head. They may have a variety of those issues going on. So once we know that that's what we think her problem is, and we know it's hormonal, we're going to ask her the next time that she goes into her monthly cycle, 3 to 4 days before the cycle starts, we want you to remove all dairy from your diet. Because dairy is a source of hormones. And that's, with her hormones are elevating, and when she adds dairy to it, pushes her way over the brink. So we're going to say 3 or 4 days prior to the cycle, and then 3 or 4 days into the cycle, no dairy of any kind whatsoever. And if they're willing, remove the meats that are of hormonal influence. And by there I mean the chicken, the poultry that's treated with hormones, if she can, eat hormone-free. She's got to have meat. The beef is treated with hormones, just skip it or go to grass-fed, and we'll talk about that later. So we're going to ask her to do those things. And then at the end of that, have her call you and tell you what's happened. And I'll tell you what's going to happen. She's going to say, it wasn't that bad. It didn't happen this time. Now, if instead of being cyclic, it's all the time, 24/7 that she's on, and she's still got all this pattern, you need to suggest to her that she just reduce her dairy intake in total and reduce her hormonal meat influence in total. She could go to non-fat things, which are not quite so bad, but reduce it in total, and she'll see that she can achieve control by doing that. But we'll take the easy one first, and that is that it's just pushing her over the edge, and it becomes a cyclic issue.
Excuse me.
Yes?
What about soy?
Soy doesn't have the element here, because what we're talking about is animal-to-animal hormone. And our hormones, compared to, for example, a cow or a pig, are pretty comparable. Poultry, not so much, but what they do is they treat the poultry with hormones. So now we're talking not poultry hormones, but we're talking mammalian hormones.
I'm sorry, but I was told that soy actually triggers your hormones as well, too much of it. And I don't want to use myself as an example, but I had the huge problem that, and my boss actually told me, maybe you should stop doing soy because that triggers your hormones as well. And I was actually doing protein shakes in the morning, soy only, and hemp protein, and I just had just tons of little tiny.
What was your source of protein?
It was hemp protein.
Okay.
I think that, but
Yeah.
then I still have tons like on my jawline, the hormonal thing like that.
Yeah.
And then I don't know, my boss told me that it was
It's-
probably the soy, because of the tofu and all that, 'cause and
It
it
very,
has a
it can
difference.
be. We're all very unique human beings.
Yeah.
And I thank you for bringing that up because, okay, that's one thing we had never had to experience.
Mhm.
Because every time we did dairy, it worked, so we never looked beyond dairy.
Mhm.
But there is another option for you. If they don't respond to the removal of dairy, ask them about their soy use, and if it is an issue. There's another element that I'll throw out, and that is, what is your tolerance to gluten?
Oh, and that's the other thing too. I was trying to do the G3 diet, and I felt really good doing that.
You know that soy contains gluten. It does.
Actually, yeah, I'll tell you. it
Oh,
contains
really?
gluten.
Okay.
So we've got an overlap there.
Uh-huh.
So one way or another, whether it be pure soy, and it probably wasn't, it was probably soy made with gluten.
Mhm.
So you may have some issues. So it can, in rare cases, become more complicated. In 99% of the cases, it won't become that complicated. And we'll talk about gluten intolerance in just a minute.
I'm sorry I have to leave, but thank you for the information.
Oh, you're very welcome. Thank you for
I'm
sharing
so
that with
sorry,
us, too.
but thank you, Bill. Okay.
And then Larry, you the next part?
Two quick asides. Glenn had mentioned gluten and celiac disease. Sometimes we get questions on, some of your products have wheat amino acids. Will that affect celiac disease? No. The wheat, it has to go internally. Topically, it won't have any effect, so don't worry about that. It won't have any effect, so don't worry about that. Number two, mentioned mammalian hormones. Just as a clarity, Premarin is conjugated estrogens used for menopausal women. It's been prescribed for years. It's one of those estrogens that they're trying to cut back. Premarin stands for, to get the name from it, is pregnant mare urine. There's a whole bunch of horses in Kentucky running around with bags collecting mare urine. They synthesize, they extract the estrogen, put it in a pill, and you swallow it. Well, none of you do.
I don't.
Yeah. So with that, you know, with the hormones from animal to animal to animal can have an effect. Chickens are bred so much now that they have such large breasts they can hardly walk. That's due to hormones. So milk, chickens, that type of thing are a big source of extra estrogens. Another big source of extra estrogens, oral contraceptives. But those are used to treat acne. And I know you've probably heard of people, well, they put me on the pill because it helps my acne. Oral contraceptives are two ingredients, estrogen and progesterone. It's the progesterone component that they're interested in, because the progesterone component suppresses the overproduction of the sebum. That's the one and only use for it. So it decreases the production of sebum in the patient. They still have to control all of the other ingredients. So if someone's really a user, overproducer, it may help, but it's going to take months before this starts to have an effect. Some oral contraceptives work very well with this because they've got a certain type of progesterone. So the ones you hear, orthotricycline was the first one out on the market, and a lot of these have gone generic. With that, Yasmin, Yaz, Brevia, Modicon, but there's also a whole group that have a different type of progesterone that actually will make it worse, like Nordet, Loestrin, the Orthoevra vaginal insert will actually make their acne worse for that because it works just the opposite. So it's going to increase. So again, as you're getting your young women clients settled in, where have you been? What have you been on? They may not want to tell you. Older women don't care. If you've got a teenager, she may not want mom to know, but you need to find out, are you on oral contraceptives and which brand? if you aren't sure which goat, call me. I'll tell you, yeah, that's a good one, that's a bad one. Part of your problem, if you really get a sebum producer, might be they're on the wrong oral contraceptive because their OBGYN wasn't worried about the acne. They were looking at what other problems and conditions there are. When you get especially some of the older women on more mature, I don't want to say older, but then you're looking at the potential for blood clots. They shouldn't be on it past 35. They can't smoke. There's a lot of different health factors. Do they really want to be on oral contraceptives if they don't need it for sexual activity or whatever? They really need to be on that just to decrease the sebum production, because we'll do it externally. They don't have to work an internal pill, change their whole clock, all of the other consequences, the cancer problems and all that sort of stuff, just to treat that one area. So that's the area with that. Spironolactone is related, works somewhat like it. It's a synthetic steroid. First came out to use for blood pressure. It's got some diuretic properties. It does basically the same thing as oral contraceptives, just not quite as well. So they will take a woman that can't or doesn't want to be on an oral contraceptive. They can try the spironolactone. It will have some effect on the sebum, not as much. The other little benefit of both of these is the little shiny chin hairs. Sometimes this clears that up. So sometimes they get a little side benefit, or they'll use spironolactone just for the fuzzy look. They don't want to get waxed or whatever. So that's used somewhat the same way, again, for sebum production and sebum production only. They can be expensive, they can have side effects, they don't necessarily need to be used to control sebum, because we can control it the other way. Yes?
Can you comment on these new products for women with polycystic ovaries syndrome?
Oh, yeah, I can.
And what we found is there is very, very frequently a weakened gluten tolerance to it. There is an inflammation that is going on in their body, and hormonally it's being exacerbated, but I'll get to it as we go into the next series. I wasn't going to speak about it, but when we find somebody who has acne, and it's usually moderate to severe, they have ovarian cysts, we always pull them off gluten. And generally we get a clearing in it. It's just one of the symptoms that the inflammation of the body is at such a peak, it shows up everywhere.
And then do they have to stay off the gluten forever, or is it like a 3 or 4
Well,
month period
yes.
and then?
No, they have to stay up
Stay
forever.
off it.
Yeah. If they even make a mistake, it can be a lethal mistake. And as they get older, the mistakes become intensified. Like if I make a mistake, it's a 3-day mistake. And it goes on for 3 days with symptoms that you don't want to hear about.
So is that why, like, they would be going fine and then they have their whatever at a party, and the next day they act,
Yeah.
so
In fact, when we get to
it's like
gluten,
an
I'll
instant,
explain
yeah.
how difficult it is to diagnose that. That's why I'm taking 2 before it. If we can identify it as being hormonal, then good, that's it. And the next one, if we can identify it as being that, good, that's it. And if we can't, then we have to push it back into gluten inflammation. So with that in mind, I'll go to the second one. If we've eliminated, there is no hormonal pattern and there is none of that going on, then let's look at another group of people, and they're easily identifiable as well. Their acne tends to be cystic. They frequently have melia. Blackheads are common. So what you're seeing in here is a very congested skin condition going on. Sometimes they complain to you and they say, my skin is dry on the top and oily underneath. My skin is oily on the top and dry underneath. And they don't really know which it is. What they're saying is that their skin just seems to be all plugged up. And when these symptoms are apparent, then we know that they have an essential fatty acid issue. It's interesting, there's a person in the classroom today who I will not identify, who made some comments about her acne earlier in her life, which is now totally under control. And she described very, very briefly, and I said, oh, you have the essential fatty acid problem. She said, yes, I do. So somebody, somehow, she got that information, and it was dead on. And she was able to correct the essential fatty acid problem, and she no longer has acne, and she has beautiful skin. Yes?
Before you go on about essential fatty acids, I was wondering if you could briefly explain what an essential fatty acid problem is.
Okay, I'm sorry. Essential fatty acids would be omega-3, that's common, you are aware of, omega-6, which is one, and we're going to differentiate between those. Omega-9, which is oleic acid, that would be, oleic is olive oil, for example, contains, that's how it got its name, it's an oleic acid. And there are a couple more of them, but the two that we'll worry about are omega-3 and omega-6.
I'm familiar with what they are, but I'm just confused as to what you say is a problem. When you say it's a problem, what do you mean that it's a lacking of?
Yeah, the
Okay.
problem is the last issue. They're lacking of generally because their digestive system doesn't absorb it well. So they can eat, for example, a good diet, but their system, the small colon, is not breaking the fatty acids down and absorbing those fatty acids. Or it's an improper mix, because as you know, omega-3 is anti-inflammatory, but omega-6 on the other side is inflammatory. So if they're out of balance, then they're promoting inflammation, and we want them to promote anti-inflammation. Okay, so I should have gone on with that before digressing.
That's okay.
But thank you. One way or another, we covered it. And we're not done with it yet. Usually, sebum is produced with linoleic acid, and that's all fine and good, and everything goes perfectly normal. But when linoleic acid is not absorbed, and it's not there, and it's not in correct ratios, then they start producing sebum with oleic acid. And oleic acid becomes immediately inflammatory to the canals, follicular canals, and they develop the blockage, et cetera, et cetera, et cetera, et cetera. So that's the problem. Absorption leading to inflammatory sebum, and they get very dry, hard plugs. And that's what creates the whiteheads and creates the blackheads. That's a pretty easy thing to solve. All we have to do is put more of the material into the system that we want to be absorbed in a better format so that it can be absorbed more readily. If it's a moderate case, we suggest 1,000 milligrams of flaxseed oil a day. If it's a severe case, we suggest 2,000 milligrams. For example, one in the morning, one in the evening. And all they have to do is just swallow the pill capsule. The results usually occur in about 3 weeks, but there's a trick here, and that is the plugs that exist, that pre-exist, are already there. These are not going to dissolve those. Those are going to stay. And eventually you'll be able to extract some of those and get rid of them. But the development of new plugs is going to diminish significantly. So they'll see a little bit of relief in no new cysts, but the existing plugs and whiteheads that are there are going to continue to be there. You can also do a little bit of heat therapy with them if you want to break that up. Heat therapy with massage and a good lubricant, getting as hot as you can, massaging, working it up out, because heat will begin to break that plug up so that you can move it out a little bit. And better do that than the piercing of the skin. Any questions about essential fatty acids? They're really pretty easy. And we've now, out of the 10% group, that's at least 7 or 8% right there. So we only have 2% left.
If someone does have a problem absorbing in their gut the essential fatty acids, how are you working that?
Well, that's a hard.
I'm having this problem right now with one of my clients.
Okay, it's the
She's got
diet.
irritable bowel syndrome
Yeah.
too, so I think that's all together.
It's all rolled in together. Her eating patterns are not good. I don't know what it is, and you need to sit down and talk with her and have her tell you, give me an average day of eating in your life. and determine what that issue could be. It could be that she's taking in an awful lot of protein. And protein is very, very hard to digest. It takes, we were not developed as meat-eating animals. We were developed as hunters and gatherers. So we eat twigs and berries and fruits and things like that. And occasionally we get a worm in an apple. So that's where the protein came. But we are not going to catch a water buffalo. And people today eat like they just caught a water buffalo. You know, I'll have a 6-ounce steak and crab legs on the side, and then I'll have a pepperoni pizza for lunch. So it could be dietary, and it could be too much protein in her diet, and that's causing her, it's causing her intestines to work way too hard for food. So try to get the easy things into her system. Fruit is so easy to digest. It's the perfect thing to have for breakfast is fruit. You don't want to overload the system, just have part of an apple, have part of an orange, eat the peel along with it, have a little bit of green banana, not overly ripe, and a little bit of low sodium V8 juice. And that will quiet it. For lunch, have some vegetables. Do not put meat into the system. And have her eat that way for a while, and the irritable bowel syndrome will probably go away. There's another possibility that it is celiac disease. And then that's the next one we're going to do, so I'll wait on that one until we get there. But you've got to get some information, and her problem is her diet. She could be too Western. I'm a purist. If I eat, for example, and I rarely do eat meat, I will not eat rice, I will not eat a potato, I will not eat bread. Reason being, to digest that meat, I've got to have a very acid stomach and small intestine. If I want to digest the pasta or the bread or the rice, I have to have a very alkaline digestive system. How can I process an acid and an alkaline meat at the same time? I can't. And what do you get? Irritable bowel syndrome. So it could be as easy as, you know, don't mix those conflicting. And I didn't want to get that far into diet. But you see, and you only run into this occasionally, but you'll be able to look at the diet and just think back. Did my ancestor 10,000 years ago eat pasta with water buffalo? No. Should I? No. And did mostly what they eat was fruits and vegetables? Yes. Should I eat that? Yes. Okay.
But also, just very quickly, its absorption is a difficulty. Even with malabsorption syndrome, you do absorb some, so it may be a little more dose related. You don't want to get to the point where we're starting to really irritate the bowel, but 1,000 milligrams don't work, 2,000 milligrams, 3,000. If they don't absorb it, it passes through. So they're going to absorb, you know, they may get a better shot. It's not always dump more in, get more out. But it can be a situation where maybe they're just going to, you know, spread it through the day, give them more in each meal, and they may absorb a little bit more. Okay.
Okay. Then, we're right on schedule because we're getting ready to come to the final segments.
We will not keep you here till 6. You'll get out and be able to go gamble.
No, you can go to the booth and pick up more information.
Yeah, there we go.
If it isn't the 2, and I think you know now how you can identify the first 2, you know the hormonal, you know the blockage of the essential fatty acids. If it's not either one of those 2, it's probably gluten. And this is the tough one. I asked Larry to eat gluten-free for 2 weeks. How many days did you
I lasted 5 days. I'm a meat eater, I'm sorry. I'm not like
well, it isn't the meat, it's the
Yeah,
other
it's
thing,
the
it's
other
the bread and all
Yeah.
that. You're going to have to ask them, and this is very important. It's very important in all of these cases because if they have a hormonal issue or if they have an essential fatty acid absorption issue, it's a lifelong problem. You might as well identify their medical problems now. Gluten. Ask them to go gluten-free for 2 weeks. And that means no cereal. In fact, I was at a doctor's lecture who's written several books, and he refers to Special K as special killer for everybody. No cereal, no bread, no pasta, no crackers, no cookies, no pies, no cakes, no pretzels, Nothing. So you're largely down to fruits and vegetables. If they can eat corn tortillas. So if they want to do some Mexican food, they can do that. They can go to Whole Foods, and Whole Foods now has a frozen section of gluten-free. They can go to numerous other stores that now carry gluten-free products. But you want to just test for their life knowledge to see if they're gluten intolerant. If at the end of 2 weeks they say, you know, my acne is clearing, sorry. But, you know, people live with celiac disease, and it's manageable. You do what you have to do. And better that you identify that for them so that they can get their life on course than someday they just keel over dead because of inflammatory syndromes. So that's that part. Any questions on it?
I have a question. We're generally taught that a blemish, you know, by the time people gets to the skin, it's been in the progress for a couple of weeks.
Yeah.
So 2 weeks is really going to show you?
Yeah,
Because of the
actually 2
inflammation factor?
2 weeks will show. We had a really interesting client from Singapore, and he was very attuned to his skin. He was able to determine that the 4th day that it was working. And he looked at side issues. He looked at a level of erythema, which was reduced. He was looking at a whole variety of things, and he said, I just saw it. He said it was perfectly clear. So he tested the theory, and after a couple of weeks on gluten-free diet, he ate cereal 3 times a day, a couple of bowls, and the next day he exploded. So there's a counter way of, zits popped and he exploded, frankly. But so let's talk about some of the acne promoters, and I'll explain why they are acne promoters, and that is sugars and starches. And the starches would be refined wheat, not whole grain wheat, but refined. Cereals, not whole fiber cereals, but refined cereals. Potatoes, rice, and all of that caused hyperglycemia. And when it causes hyperglycemia, the insulin level spikes. And that causes the production of testosterone. So if you have somebody who you suspect eats way too high on the glycemic tree, suggest that they cool it a little bit. Don't promote more testosterone. Yes?
When you say sugar, is there a specific type of sugar? For instance, refined sugar as opposed to cane sugar, or?
Most natural sugars are really just refined sugar, frankly speaking. Refined sugars, the food manufacturers have added color to, and they call that natural sugar. So you can do some sweeteners, some naturals, any one of the natural sweeteners, as long as yeah, because it doesn't spike the glycemic load. But the natural sugar probably isn't natural sugar, and it's going to cause the spike. And it's the spike. It's not the sweetness, it's the hyperglycemia. So they can use other things.
Can the same be said for high fructose corn syrup?
Yes.
Would that be considered in that sugar family?
Yeah.
Okay.
It's interesting, there was a study that was published just a couple of months ago, and they used males, and I think it was 30 of them. They divided them 15. They all had equal acne. The 15 that went on the low glycemic load diet cut their acne by 50% in 2 weeks. So that was really pretty clear that it is an aggravating factor. And here we're just giving you additional information. It's not one of the 3 things that's causing the 10%. It's one of those things that you've got a person who's up and down and up and down and up and down, and you might say that they could benefit by not eating an acne-promoting diet. This one we couldn't go without saying, and that is meat and dairy. We have to go right back to it. And we've said it again, and Larry said it in many, many ways. If you add the hormonal influence to your diet, your acne is going to increase. So you really need to be on a diet of moderate amounts of animal protein. Meats contain a great deal of omega-6, and I'm going to differentiate here. When your great-grandparents and my grandparents ate meat, the cattle grazed in the field, pasture, and they ate grass. And the fat of those cattle was omega-3, which was a good one to eat. But in the 1950s, feedlots came in, and they started feeding cattle with grain. Grain-fed cattle produce omega-6 fat, and that's very pro-inflammatory. So our meat today, it isn't that meat is awful, it's the fat content. If they can eat free-range meat or free-range poultry, it's much, much better, and it won't promote inflammation within their body as grain-fed and human processed. The same thing with fish. People were saying that, what is the fish that everybody's, tilapia. Tilapia is so good for you. It used to be, it isn't anymore. Tilapia used to be wild, it was omega-3. Now it is farmed, and it's fed grain, and it's omega-6. And it's just as bad as beef. Any fish that you're going to have your customers or you're going to eat, you want to get wild. You don't want farmed fish because it's omega-6. And it's not good for your body, it just promotes inflammation. So those are groups of foods, not specific foods, but groups of foods that are not wise and that are acne promoters. And on the flip side, the acne inhibitors are fruits and vegetables. The same thing that rural China eats, fruits and vegetables, they will not get acne with those. Good fats, which would be wild omega-3, avocados, nuts, and seeds to a limited amount. Spices are great, turmeric, ginger, fennel, parsley is another wonderful one for them to eat. Tea is an acne inhibitor, green tea, white tea, red bush tea is very popular right now, that's a good one. And detoxifying foods. And detoxifying foods could be as simple as some watercress or lemon or cilantro. You can make a wonderful pesto with cilantro, roasted pine nuts, or toasted almonds, lemon rind, lemon juice, and garlic. It's absolutely wonderful. And I eat it by the tablespoonful, since I can't eat pasta. Or apples are great detoxifiers. So they would be acne inhibitors. One last area that I want to cover, and then we'll be done, and that is when your patient develops an acne, or anybody develops a cut, an injury, or whatever, there is a natural biological pattern, and that is within 90 seconds of that injury, the area saturates with zinc. The zinc continues to rise, zinc levels continue to rise, and your body knows to flush zinc into that area for 7 days, and then in 7 days it drops back to the 14th day to be normal. The opposite happens with antioxidants. You start out at the normal level, it drops down by 60 to 70% at day 7, and then comes back up. And to let you know what's happening in those processes, zinc is called the cleanup enzyme. It's one of the reasons that we was very happy to use it in the products. Think of your patients who have moderate to severe acne. Put all of those cysts together into one, and you would have a nice big infection, like this big. Now we'll add to it, it's chronic. It goes on all the time, 24/7. That's a pretty significant wound. You need to look at your patient as having a pretty significant wound that's draining their body, and severely draining their body. Zinc immediately comes because it's the cofactor in enzymes called elastase, collagenase, metal proteinases, and what these are the enzymes that break down all of the destroyed tissue because of the enzymes. Collagenase, for example, breaks down collagen. Elastase, elastin, etc. So zinc is called the repair enzyme. It breaks down all of this dysfunctional infected tissue so that the chemicals can be used. Zinc is then required for the production of elastin and collagen. It's required for the development of new blood vessels because they went like this and they broke all the blood vessels and capillaries. It's used for all of the repair process. So as you get, the bigger that cumulative infection becomes, the bigger the load on the body's zinc level, and your patients become zinc deficient. They can't support total breakdown. They cannot support a total rebuild, and the result is scars and pigments. So what we normally suggest is, since we know that we have a systemic deficiency, I'm going to go forward. We put it into the products, so it's going to be there, so we're going to apply it topically. But you might also suggest to your moderate to severe that for a period of about 4 to 6 weeks that they take a zinc supplement. And all that they need to take is 15 to 25 milligrams daily. If they're already taking a multiple vitamin, it may be there. Chances are they aren't. You just want to get the body's zinc level to the point that they can sustain a repair without creating a pox mark, a scar, a bunch of hyperpigmentation going. Yes?
Are there different forms of zinc?
Yeah.
Supplement?
Yeah.
And which kind should I recommend?
Most of them are relatively good. Do you want to answer that?
There's going to be, it's not going to make a lot of, there's zinc sulfate, there's a lot of different chemicals out there, but I think your supplements are going to have, you're going to have one choice, and that's it.
Oh,
So
okay.
they're going to limit it. They're not going to give you like the gluconate, the propionate, the sulfate, the sulfite, because some of those aren't absorbable and active orally. So when you go to your pharmacy or your grocery store with a counter on it, you go to the vitamin section and there's going to be, it'll probably just say zinc,
Okay.
10 milligrams.
Okay.
15.
25.
Yeah. Okay, that's the zinc part of it. The antioxidant part is the opposite. When all of this repair needs to be done and all the decomposing tissue needs to be removed, there are literally trillions and trillions of chemical reactions going on simultaneously, and I mean simultaneously. And those create a free radical hotbed, so to speak. The skin turns red because it's oxidative stress. So it's pulling as much of the antioxidants that it can from the body, but as I said before, it's at the end of the train, and there just isn't much left whatsoever. So if they can topically and orally resupplement themselves with antioxidants, that helps the rebuilding program become non-destructive. It eliminates some of the oxidative stress and eliminates some of the free radicals that are just going to continue to slow down that repair process. So these are two little side elements which just can make you totally different in your understanding of acne from anybody else who they've ever talked to, and give them the advice that they need to get themselves back into good health. If you can do this for these people, I guarantee they will be your patients for life. I guarantee they will refer everybody they see. I guarantee they will drop down on their knees and turn east every time you walk by. So,
and also with zinc, many years ago I owned a home infusion company, and we had several patients that, because of the loss of the gut, they had everything they ate, all their nutrition came through an IV that feed with a pump through the night. If these people developed a bed sore or other lesion, first thing we added, zinc gluconate, because that's the best thing to heal a lesion nutrition-wise that they could add. So zinc gluconate was added by all these high-class physicians to treat that lesion. So that's one of the reasons we're putting it here to apply topically or work from the inside, because it is such a powerful aid for lesions.
and the last slide is yours. This is the last slide.
Yeah. So I think we got one quick one. Antioxidants are in a lot of different products. There are a lot of different foods. There are a lot of different areas. We have antioxidants in virtually every product we make. Our anti-aging line, our acne line, our skin rejuvenation line, even our sunscreen, we have antioxidants, because as you're getting bombarded with the sun on that, even though we're reflecting out, you're not getting much of it, you're still breaking it down. Antioxidants are important. You need to add antioxidants to treat that. You need to add a diet rich in antioxidants to help with those products. With Vion, we've got products that I think you need. We are unique. We work strictly for you. But again, if you use the product that's going to work for them, you're not using the same thing they failed and failed and failed on. We have 90% success with this, and we've just given you keys how to treat the other 10%. So you get a virtually 100% success rate, and if you don't, we'll guarantee it 100%.
Calls.
The person comes back in, if they tried it. Now, if they come in and you know they haven't used it, tough luck. I had somebody call and say, well, they bought our stuff and they went to the dermatologist the next day, so now they don't want it. Will you guarantee it? No, sorry, I'm not that stupid. But if they've used it, and they've used it 3-4 weeks, and for some reason they aren't happy in any way, you refund it to them, we replace it to you. No questions. We do this about 3 times a year. And we've got patients all over the United States, Europe, Canada, Australia, Azerbaijan, Russia. Yes.
Do you have acne line in for general or kind of similar? I mean, in one time, because acne can be mild or moderate, but do you have like different level for the severe?
We went through this a little bit. We have a standard three treatment.
Okay.
And then we add one with really severe acne. We add a 4th product. So you only add that 4th product. Generally, add that 4th product just for the really severe.
It's a booster. I'm talking about the home regimen because you need to use it. Okay.
It's a booster. It's a
booster.
rebalancer. It's loaded with zinc. It's loaded with antioxidants.
Right.
It's loaded with all the things.
And we just to make it simple. You can look at these. We've just come up with travel size. We introduced them yesterday at the clinic. They helped get this going. But that's our standard. So it's the 3 treatment plus the moisture. This one, 3 treatment plus the moisture. The difference is the different cleanser, depending on if it's oily or dry. The different treatment, either salicylic glycolic or follicle clearing. The green tea is the same. If then they need that little booster, then we use the inhibiting gel.
What's your main ingredient in the acne cleanser? Salicylic acid?
No.
No.
We went through that. I think you came in late.
I'm sorry. Yeah, I gotta go back a little bit.
When we're done, why don't you step up and we'll go through all this.
Okay.
The thing too is we
Thanks.
videotape this today. If you become a Vion customer, this will be available to you.
And no charge.
I know we threw a lot at you today, but we wanted you to walk out of here thinking, I can do this. This is easy to explain to you all. Okay, we'll start. You raise your hand first.
Hey, can you comment on why you chose not to use your Retin-A product with the acne kids?
Didn't need to.
So you
Just
don't
didn't need to. It was just, Retin-A can be a little irritating, so we did things that were not irritating, anti-inflammatory. We just chose to go that way.
Do you find that it's helpful in trying to resurface when they've had scarring or?
Absolutely.
So
Once
at
you
what
got
point
them-
would you
yeah,
add it?
once they're under control, then you can start the resurfacing program, working with it that way. And there's some other things too. The gentleman, Colin Campbell, did a huge amount of research on calcium. And he's the reason that we developed the BioEssence Nighttime Calcium Cream. So marry that with the vitamin A, because it regulates the skin in 4 different ways. And part of it is the rebuilding of the skin. So that makes a really nice program. Question?
What is the price point range on these products?
Very moderate.
Our product, we sell it to you wholesale. We don't do it retail. The price for the cleansers, that'll last 2 to 3 months. Wholesale to you is $9.80. You sell it for $20. The wholesale for the salicylic glycolic follicle clearing, I believe, is $10. We sell it for $20, $10 or $11. The green tea is $11. You sell it for $22. These will all last at least 2 months. So we're talking a 2-month regimen is about $60. The patient goes to you know, the physician's office, they write a prescription and think, oh, good, insurance will pay for it. Bingo. None of those things, Tazarac and all those aren't generic. So you're not getting a $10 a month copay. It's $50. You may get a coupon that the manufacturer will rebate you the first time for 20 of that. But it's going to cost you $50 a month for those brand name prescription drugs. So it's going to be more expensive at the dermatologist's office. Their insurance may pay for the office visit where they won't pay for yours. But when they come to see you, you're going to do a treatment. The dermatologist may do a little extraction, but they're in and out there in about 3 minutes because he's busy, he or she's busy. So they're going to get a lot more service for your $75 treatment than they'll get from their physician for that $200 charge and maybe a $50 copay for that physician visit. So we're very moderate. Our minimums are low. Our minimum for shipping is only 10 items, and we do have retail and we do have back bar. The back bar are significantly larger at a modest increase in price. We basically sell them at cost. So you can mix and match retail and back bar. We won't sell you only the back bar because we need to make some money someplace on it. So we generally ship the same day. We protect your area if you are a client of ours, and we won't sell to another person inside your service area, your zip code or whatever, without your permission. And we have turned down very large facilities because we had a 3 esthetician clinic that we've had for years, and that was their territory, and they say, no, we don't want it, so we turned them down.
And the other people just wanted it because they found out how effective their competition was, and they wanted a piece of the pie.
Yeah, they have people coming in, I need Bion, do you have it? No. Oh, so we get we do minimum advertising. We don't have a sales team out there. So we do some magazine ads. We do it, we haven't come here for a couple of years because it just hasn't worked out real well. But most of ours is our website. Most of ours is word of mouth. You know, I've got a friend, you know. We just added in Long Island. My friend said you should get that. So, boom, you know, $800 order just by word of mouth. So those are the types of things that we keep it modest. We work with you. When you call to visit with us or place an order, you get a skincare professional that knows what they're talking about. Usually Barb, who's at the booth, she's an RN. She'll answer the phone most of the time, or I'll answer the phone, because we want you to get your answers quick. We want you to get them right. So you can have, if you've got a question in the treatment room, you say, just a second, I need to go get something. You go grab the phone, out of sight, you call us, we say, do this, this, and this. You walk back in and say, okay, I'm ready, and they don't even know it. So we don't waste your time.
Any more questions?
I'm looking for some input for rosacea acne.
Okay.
Because most of the companies selling acne product is mainly for try to control the sebum. But I think it's really opposite if you want to treating the rosacea acne, which they have a very dry sensitive skin.
Yeah, they do.
So do you have a little modification line for that?
We have the product. And
Okay.
It's again explained there too, but Larry will go over that with you. It's just a real simple, you just select this group.
Okay.
So we made it foolproof. We've done it for so many years so successfully that we made it just easy. It does not have to be complicated.
I have lots of questions for you. Do you have any suggestions where it's pretty much under control, but they get friction? Like say maybe an athlete that has to wear a strap?
Oh, yes.
Or do you have any suggestions?
Yeah, but they need to treat their helmet or whatever with like the cleanser, just a quick wipe and all of that. If it's a headband that they're wearing that can go into the washing machine, do that. Or a pillowcase.
Or a jock strap.
Yeah, just do it more frequently and do the wipe down of the area on the chin strap. And the helmet right here is really, I play football and I can tell you this is the bad place. And so many kids on playing football had that band.
So you think it's that
the bacteria is there, it just gets rubbed into the skin.
It's not
yeah.
a friction irritant?
And the inflammation and the
causing
sweat and the heat. Yeah, it's all of those things together. It's just a perfect incubator.
It's caused a congestion by the blocking from the oxygen. I mean, you're blocking the area.
It's like, yeah, it's the
breathing.
whole 9 yards, and it's all going on together. That's, you know, if you want to be a football star, I wasn't, but That's the price you pay. Just wipe it down like every couple of days to get the P. acnes out of there.
Is there, are any of your products you can use to sort of make that area like slicker so that the helmet or the swim strap won't rub it as much, but it's not
not
gonna.
the rubbing, it's the buildup of the P. acnes on the equipment. So it's always going to rub. It's just the P. acnes is literally being forced into the skin in a great plenitude. And it's hot.
So just putting some of the cleanser and letting it dry?
Just put it, wipe it off, wipe it on, wipe it off, to get it clean, to get the bacteria gone. And do that. If they're practicing football in August and it's really hot, do it every day. If it's November, every other day.
And with that, it might be an equipment problem, because a helmet or ears and the ear things in wrestling shouldn't be slipping. They're built to be stable. If they slip, it's not fitted right, it's too large. The chin strap, if it's slipping, it's not fitted right. It's a fitting problem. With today's equipment, liabilities for high schools and coaches, they have to be fitted right. He needs to go back to the equipment manager or the coach or whatever and say, this isn't right. This should not rub and move, because if it's moving when they get hit right on the top of their head, that's going to come down and it's going to break their nose. So that can be part of it too.
Sorry, keep asking more. You have any comments on bumpy arms? Is that type considered as acne?
Thank you. Yeah, that's essential fatty acid, and the pattern is right here.
Yeah, only that area.
Yeah, only this area. When you see that, they again have follicular blockage. It's an essential fatty acid problem. Put them on the supplements. Again, it won't resolve what's there, but do some hot tissue massage to break it up after 3 or 4 weeks. You have them on
They're
essential
really
fatty
tight.
acid. They're really
Really
tight.
tight, yeah.
Yeah, and they can also get them on the upper thighs.
Yeah.
But whenever you see the bumpy arms, what is this?
Yeah.
It is an essential fatty acid plaque and blockage, and it's sebum. That's all it
They
is.
can be fluctuate for a day, get hot and red, or bigger bumpy, and
Yeah.
other day could be calm, and they fluctuate from day to day. So I've been looking for many different products to buy, and
Well, these will resolve it to a certain degree, but you've got to get them on the essential fatty acids. They have to be on for 3 to 4 weeks, then bring them in, do hot compresses,
Okay.
do some massage there to break this stuff up, and that will help them considerably, and then the EFAs will help them not produce that again.
if I use any AHA exfoliation, like or a scrub, would it help?
Yeah,
Is that-
you can use the glycolic salicylic from here as a daily treatment, that will help. They're not getting infected, they're just getting these lumps.
Just need to have them open up to release the.
Yeah, and that's the heat part.
When it comes to nutritional supplements, like in brands, what type do you think is the best to recommend?
Brands, I don't think there's...
Brand-wise, like
Brand-
name brand-wise, what supplements do you think are the best to recommend?
I'm not really into brands. I hear the infomercials and all of that with our brand is better and this and that. Most of it's hype. Your body doesn't really know the difference between the same chemical. So I would go for what's the best selection in there. If it meets all your requirements of ingredients. If it's a national brand that's got a reputable reputation, I wouldn't worry about it too much, because if it says a certain type of nutrient, that's what's in there. It has to be. For them to sell it, FDA requires. So you start getting into some of the brands and they say it's better, or they try to tweak it a little bit. A lot of times that's just a maneuver to make them somewhat different and to raise the price. You see that in vitamins, you see it in skincare, you see it a lot of different places. As a pharmacist, I'm used to generics. Your system can't tell the difference. They work essentially the same, and it's not worth going to a Cadillac price for buying a Toyota.
So
Because the
the
brakes won't work.
supplements around the shelf at Walmart would be just as effective as something else?
Pretty much, because Walmart buys better quality on some of that. Now, they may have 2 brands. You may want to look to see what's in them. So I'm more interested in the back of the package, far more interested in the back of the package that has the list, how much, than I am the front of the package, who makes it. Because this came from Walmart. It's Clear and Clean is one of your biggest competitors because Walmart has this every place. You'd be surprised. I was surprised how much stuff. And it's made by Johnson & Johnson. How would you know? Now, Johnson & Johnson makes this for probably 40 different companies. And it could be all the same stuff, but it may be different. As part of our class, we went through a tour of Eli Lilly. They had their manufacturing lines. They had an aspirin line going out. This one was branded. That was generic. Same line, same ingredients. But you don't know. But then they make drop-ins. So some things are less quality, but they leave things out. So look at the ingredients. You want the full range, as many of the full range and the right concentrations, because those will change. So I just turn over to the back and don't much care which company, because you may not know the manufacturer anyway. It may have, you know, a wonderful name that sounds great, but it's manufactured by the same as the discount one right over here.
Well, would a more organic, but maybe I phrased that wrong.
Okay,
An
sometimes
organic supplement be better for you than a supplement off the shelf at Walmart? Because I work for a company, a skincare company that had a line of supplements as well. Sorry, and you know, they made a big production out of the fact that the capsule was made of rice paper or something like that. So, like, would you be better off going with an organic supplement versus something off the shelf at Walmart?
And sometimes, if someone doesn't want the gelatin, on the capsule is gelatin, so it's, you know, it's cartilage and that type of stuff. They don't want the gelatin, they can't tolerate, then maybe that works better. Some organics are better. You get away from some of the other ingredients. Again, vitamin A can be different. We don't use the retinoid, we use retinoic acid. Vitamin A is not necessarily vitamin A. Ours works better than most of the others. There can be subtle differences, but you almost have to go and investigate which are actually the same, which aren't. Some of these are chemicals, they're not organically grown. We like organic and natural as much as we can get. Sometimes you don't have a choice. So it can make a difference. If your preference is that, I would rather be the more natural source than the chemical source, because your body's used to that. That's what we're designed to do. So if it comes down to that, certainly there's a difference on it. So there can be some subtle differences that way. And you know, if it's in their budget and they think it works better, that's great, because it's probably going to be a little more research. Some of the claims are over the end and it makes no difference, but it sure sounds good in advertising.
Yeah.
We're like that, yeah.
You gotta ask.
Yeah.
I have a question on one of your slides where we talk about restrict on dairy food diet, and you suggest restrict on them and make sure you know, if they are on the chronic acne, cut down and only take no fat or.
Well, that's the dairy is responsible if you have the other conditions.
Right.
So our products will treat 90% of the patients. So then we're talking about those ones that exhibit that specific type of hormonal problems. Then you try the dairy reduction, and especially with menstruating women, you'll want to start 2 to 3 days before the menses starts, continue 2 to 3 days into the period to decrease or eliminate dairy, and that should eliminate those monthly cycle breakouts.
So is it true if it's the richer dairy, like richer milk, if that way we have more hormone?
Yes.
Really?
Yes.
Okay.
During the course of the discussion, I said, or reduce the fat.
So
Because fat is a stimulant in our body.
fat stimulate more fat hormones.
Fat stimulates huge amount of
Okay,
things.
got it.
Yeah, we Americans need less fat in our diet.
Okay.
And if you're going to eliminate it, you want to
You good
eliminate
in
it.
medication. Any comment on Solidin, the expensive acne prescription? Solidin.
Solidin?
Yeah. They're about $675 from 1 month supply.
Yeah, it's a slight variation of another medication that's a lot cheaper. You know, the dermatologists have said we're only going to use that for people that have failed on the
Okay.
other form,
Yeah.
and they don't. They go right to it because, I'm sorry, they've got a sales rep that just brought lunch into the whole office and just gave them an hour presentation and maybe a golf trip. So there is.
They can feed you a
The
good
only
lunch,
reason-
so
yeah,
you buy,
yeah.
you can
The
carry
only-
it and sell
The only
it.
reason you'd want to use that is if you used
All
the
the time.
generic and you had failed on it, but they still wanted to use that same medication. In 95% of the patients, maybe 98% of the patients, they will see no difference at all. It's basically trying to take a drug that was brand name and expensive, went generic, price dropped, now 40 people make it, and it's now $2 a hundred, and they want you to get back to that $200 for 30. It's the same.
I didn't know that's generic for that Solidin.
There's not that, but what they've done is they've taken the generic drug, changed the salt. If you go back to your old chemistry, they changed the salt. So it's the same chemical, it's just now a different salt of that chemical, which makes it now patentable.
I see.
Once you get a patent on that salt, then you're the only one that can make it for all
But
those years in price.
all that does is antibacterial, antibiotic, right?
Yeah, that's all it
It's
is.
just a strong antibiotic.
Yeah.
It doesn't help on hormonal like birth control.
It's the same antibiotic that's generic, they just changed the salt.
Oh.
The activity is really insignificantly improved.
What's the generic?
What's the name of the generic?
That
The other-
minocycline or doxycycline is one of the other.
Minocycline.
Yeah. Yes, ma'am.
That if you have someone that comes to you and they are on DUAC or
Yeah. DUAC,
tetracycline
Vesiclin,
and
yeah.
everything, now I know we can't tell them to change the doctor's orders, but if you're going to advise them about how they might come off of it, I'm just curious about how do you say just stop, or do you
Can I ask that?
wean them?
You can answer that. I'll
That
see if
one
I
I'll
agree.
take.
Yeah.
We normally just say, continue right on with that. And they wouldn't be at your place if they were having any success.
Right.
And we don't want to upset the physician. Continue right on with it, as long as it's not a topical. And use this program. And when you're through with that prescription, you can decide if you need to continue that or not. And generally, that gives us 3 weeks, and they're doing wonderfully, and they're ready to say goodbye to.
Yeah.
They just need that safety cushion.
But he's talking about the oral, you're talking about the oral. The oral antibiotic. The DUAC, the Vesiclin are topical.
Okay.
They've got benzoyl peroxide, don't use benzoyl peroxide with our products.
No.
Yeah, so you'd want to tell them, you know.
No
if you want to
VP
finish your two-
topical?
You-
You
Pardon?
said
No
no
benzoyl
VP?
peroxide topical. We want you to use our products and our products only,
Topical.
because that's topically. If they want to continue the tube, fine. They don't want to throw it away. It's going to run out in 60 days of life on that anyway. You've got to throw it away. If they want to finish the tube, fine. But they're seeing you because that didn't work. Say, okay, do you want to finish or should we start today? Then orals finished, topicals, tell them you're going to set this aside, leave it here. I'll throw it away for it.
I usually, I get the tip off. Usually I tell my clients that if they come to me and check on the history, medical history, and they said they've been using DUAC for like 3-6 months, I usually ask them all the record what you've been doing and have had any change. Most of the reason they come because nothing worked for them. So I say, okay, try something new now, but you can continue to use that or set on the side for a trials process. I say because so many different products out there, they're all great, but that doesn't mean they all fit for your body. Everybody's tolerating in a different way, it responds in a different results. So usually they give it a try by that and get
And
back
success
to it.
sometimes could be subtle. People look in the mirror every day and they remember what they saw yesterday, but they don't remember what they saw 2 weeks ago. So we mentioned taking a picture.
Take pictures.
And you should take a picture, not only for us, but for them. Keep a photo with digital cameras, take a picture, and when they come in a month later, take another picture and put them side by side. This is where you were a month, this is where you are now. Try to get them the same light, same angle, all of that type of stuff. It can really make a difference. Even your anti-aging, when you put them on a regimen, this is what you looked like 4 months ago. Because they'll forget. Oh, it's not, I don't look any better. Well, they do, but they just don't remember. So take a picture and then keep a history, kind of a log for them. No, they'll think it's great. Keep a log on it, and then when you get those good ones, send them us. Get their permission to use them. Any other questions? We're in booth 1527. Barb's over there right now. We're going to be over there. We'll be here all day tomorrow. Come visit with us. We've got information. this sounds, sometimes I know this sounds kind of over the top, like, wow, this is so much stuff. It's really not. You've got the basis, you know, we've got handouts for you. The system isn't that complicated. It works. Corey, does the system work?
It really does.
Yeah.
I've never used anything like it, and I cannot believe that you guys could sell this cheap.
Yeah.
Okay, we'll raise the price.
Corey switched over to us a year ago, maybe.
In August, not even a year
Yeah.
yet.
And so it's really impacted her business and everything else, so.
I've got clients calling me, here, you've got something for my daughter. I mean, it's the word of mouth.
Yeah.
Yeah.
It's literally.
So if it works in
Now,
credit.
communicate that it's easy to use. 1 month supply, you can give it to your client and you have more control. I took this product to Europe, so this is a line.
Yeah. And if this works in Crested Butte, Colorado, it'll work in your town. Because you get all sorts of things. You get cold, you get hot, you get
I live at
elevation.
9,000 feet, and
Yeah.
it was
Dry.
blizzarding when I left 2 days ago.
Yeah.
So the conditions are really harsh.
Yeah, they are. That's why I say it. It's
All
not.
of my teenagers play hockey, and they ski, and they do everything. So they've got all of those, every issue I see.
Mhm. And it works in the Sacramento Valley, and
Yes.
you know, so
Thank you all.
Thank you.
Thank you.